Yes, yes. Uh, I would like to s- for my special thanks, especially first because Magnus Group they invited me as a speaker for the six editions of Euro Global Conference, Pediatrics and Neonatology, and thank you very much. Today, I would like to discuss about the Ayurveda management on attention deficit hyperactivity disorder in children, especially here I would like to discuss about the case study of the case series regarding to the efficacy of the Ayurveda treatments we have already used. As you know that attention deficit hyperactivity disorder, it is known as the neurological disorder. It's normally it has primary features in attention and hyperactivity disorder. And other than that, neurologically developmental disorders, most probably that most of the cases, they are come in search of our treatments, not only the Ayurveda, but special Western treatment. Main complaint associated with the inattention, hyperactivity, and impulsivity, and also emotional dysregulations. So, symptoms appear in various contexts, including the family setup and classroom and social circumstances. So most of the cases, it's not only for the childhood disorder, it has normally adults and also adults also frequently manifest in these signs and symptoms in a certain extent. We have found more, according to the prevalences also mentions that boys are more likely than girls to have ADHD, and also now prevalence is in worldwide prevalence is also somewhat high in children and adults, and it is estimated as 5.25. So that is why, but at the previously in our setup in Sri Lanka, that most of them are uh, taking treatments for Western medical system, but now most of them come in search of our Ayurvedic treatments to manage those conditions. So these are the primary features, the clinical complaints associated with the ADHD. It is including attention and hyperactivity, impulsivity behaviors. Normally, it starts before age of 12 years. Most of the children come in search the treatments, especially the age is around 3 to 7 years. That it's in Sri Lanka, it's primary school periods. So most of them, if it is, but signs and symptoms, they are noticeable as early as 3 years of age. ADHD affects not only the child's ability to pay attention, or someone is still that kid is still at school, but it also affects the relationship with family and other children. So it's somewhat a burden in family because of their behavior. So children with ADHD, inattention type, there are several, three type of uh, groups we have already observed that inattention type are mainly impaired in the presenting problem typically is academic uh, underachievement. Uh, Teachers complain that there are complaints mainly started from school. Teachers complaints about the children being chronically late and forgetful, disorganized, losing things, uh, daydreaming of tasks and unable to finish their work on time that during the period. Because of the complaints that parents wanted to take treatments from their children, and parents complaints that their child is mostly introspective or insensitive to the person's space needs of the people and has difficulty to control their impulses. These are the main complaints associated with that attention deficit hyperactivity disorder. And how is ADHD diagnosed? As you all know, there's no single test to diagnose ADHD, and many other problems such as sleeping disorders, anxiety, depressions, and certain type of learning disabilities can also have similar type of symptoms. So we have to clearly identify the signs and symptoms to diagnose the condition. It's often sometimes that ADHD have other disorders such as that can correlate with other signs and symptoms. It means behavior, conduct problems, learning disabilities, anxiety and depression. Those signs and symptoms also with the ADHD kids. So normally that in here that DSM-5 criteria, diagnostic and statistical manual of mental disorders that we have used for the diagnose this condition. These are the diagnostic criteria for ADHD. So normally symptoms or behaviors that have persist more than 6 months in two settings. Sometimes our child may be a very good behavior in school, but in home place, they have some behavior problems, but it may be the normal condition. So we have to very clearly identify the conditions when we are diagnosed the kids. And symptoms have negatively impact academic, social, and occupational functions. Patients age less than 17 years or more than 6 symptoms are necessary to diagnose these conditions. These are the inattentive type diagnostic criteria, and separately, these are the things that we have already taken to identify the cases inattention. Normally, symptoms of inattention have been persist for at least 6 months, and they are inappropriate for the developmental level. It means that often fails to give close attention to teachers, so makes careless mistake in his school setup. So normally it can be associated with the kids, but we have to observe that past histories and onset and what are the other things that babies having. So we have to think it. Often has trouble holding attention on tasks or play activities. It may be associated with the school activities or other tasks in home activities. Often does not seem to listen when spoken to directly. Other than that, they are often does not follow through instructions and fail to finish schoolwork or duties in the workplace. It means adults associated that workplace duties. But in kids, normally they are faced to finish their schoolwork according to the instructions. Often has trouble organizing tasks and activities. Often avoid dislikes or is reluctant to the tasks that require mental efforts over a long time. And also that our kids lose things necessary for tasks and activities, school materials. Sometimes in our kids that they are usually doing those things, but it's gradually. If it is persists more than 6 months, it can be the symptoms associated with the ADHD. And it's school material, pencils, books, tools, these necessary things they lose their things. If often easily distracted and is often forgetful in daily activity. So these are the main symptoms associated with the inattention type ADHD group. And other than that, there are hyperactivity and impulsivity. If the symptoms of hyperactivity and impulsivity have been persist for at least 6 months and they are inappropriate for the person's development. So these are the things that we have to identify from our kids when we are diagnose the conditions. Often find with taps, hand or feet, squamous seats, and often leave seat in situation when remaining seat is expected. So that's the main problem in school, that teachers, that kind of patients that they are normally discuss with us, that teachers told them to difficult to manage the kids at the school. So they need that shadow teachers because that babies are running here and there. That's the problem for each other when they are teaching with the normal other students. That's the problem. Often runs about or climbs when it is not appropriate. They are very hyperactivity and often are unable to play or take part in leisure activities greatly. And also, so often on the go, acting or driving by a motor car, that's the normal associated signs and symptoms with the hyperactivity kids and often talk excessively talk babies and blurt out the answer before the question has been completed. That's why that other than that, the troubles waiting their turn and often interrupt the others. Those are the impulsivity activities also associated with the kids. Therefore, considering those signs and symptoms that according to the DSM-5 criteria that they have developed in subtypes of ADHD according to the symptoms. Normally, that patient meets both inattentive and hyperactivity impulsivity criteria for the past 6 months, both. So it has identified as the combined type. Most of the kids come to our setup, especially they are associated with combined type ADHD group. And predominantly inattentive type means that patient meets inattentive criterion but not hyperactivity impulsivity criterion for the past 6 months. And predominantly hyperactivity impulsivity type patients meet hyperactivity impulse criterion but not an inattentive criterion for the past 6 months. These are the things that we have used for identify the cases when we are treating. And other than that, under the methodology, we have diagnosed the patient's kids clinically based on DSM-5 criteria. Patients were selected based on inclusion and exclusion criteria for the OPD at National Ayurveda Hospital, Colombo. And after select the OPD treatment, or select the patients from OPD, we started the treatments in IPD level. Indoor treatment started. Inclusion criteria is it's based on school-going children aged between 6 to 12 years of age with poor academic achievements, poor concentrations, increased distractibility, and motor restlessness were included in the study according to the diagnostic criteria. And exclusion criteria, the children not fulfill the DSM-5 criteria for diagnosis of ADHD, so they are excluded. And those who have other systemic disorders, because we have to use internal drugs, here we have used treatment plan regimen, so we excluded other systemic disorders such as asthmatic conditions, cardiovascular disorders, marked cognitive deficit, so we have excluded. And those who were receiving any other Ayurveda or Western treatments to manage those ADHD conditions also excluded. And this is the scoring of clinical symptomatology used for the study. Inattention, hyperactivity, and impulsivity are measured by obtaining a 4-point rating of DSM-5 items. The scoring was done regarding from never to very often. It means never means 0. It means that signs and symptoms less than 25% associated with the kids. So we have identified as that 0. And also often mean 25 to 50% signs and symptoms. Quite often mean 50 to 75 signs and symptoms. And very often means 75 to 100 of signs and symptoms. These are the criteria for assessment of total effects of therapy after completion treatments when the patient has Remaining signs and symptoms between 0 to 25% were considered as complete remission. And when a patient has remaining signs and symptoms between 20 to 50%, was considered as the markedly improved. When a patient has remaining signs and symptoms between 50 to 75, was considered as moderate improved. No relief for when patients has remaining signs and symptoms between 75 to 100 was considered unchanged or no improvements. These are the things we have used. It's only the case study series. So we have used 5 patients identified according to the diagnostic criteria. So these are the age-wise. Most of them are male kids, and another one is a female out of 5. So we have identified their type of ADHD according to the signs and symptoms and diagnostic criteria DSM-5. Predominantly inattentive type, combined type, and most 3 of the kids are in combined type, and other one is predominantly inattentive type, but we couldn't identify that hyperactivity impulsivity type for our study during these 5 cases. And as example, I have mentioned only child 1. He's 6 years boy. So predominantly interactive type, because before starting the treatments, the child had 7 symptoms of inattentive out of 9 symptoms. So we have calculated that it has 77% signs and symptoms. According to that, baby is in scoring 3. So these are the signs symptoms associated with the kids according to the inattentive signs and symptoms. So treatment plan is 40 days treatment span for 1 round. There are 3 rounds of treatments with 2 months gap. First, we have included internal drugs as well as the external treatments procedures. Under the external treatment, internal drugs we have used this means that drugs can enhance the brain function, especially in Ayurveda concepts. We have used decoction and a powder, which was mentioned in Ayurveda authentic text, and we have already used for the management of mental disorders that kind of drugs in Ayurveda setup. And external treatments procedures, we use that Shiro Thaila Abhyanga, it means head oil massage, and Shirodhara, Shiro Vasti, Sarvangadhara, Viryachana, and Vasti. This is the treatment plan we have used according to the Ayurveda concepts. For fully treatments rotations, it include 40 days treatments per rotations. We use 3 rounds of treatments with 2 months gap for the management of these kids. And these are the main ingredients of internal drugs we have used that according to these ingredients, the Centilla asiatica, Bacopa monaric, Glyceria glabra, Tinsipora cordycelia, and Nadus tetramansi is used. The 5 ingredients used as a decoctions, preparations according to the concept, and necros calamus vacha we have used as a after purifying that vacha, we have used 1/4 of teaspoon at night for brain enhancements as a powder form. So these are the internal drugs we use. And these are the external treatments, Shirodhara, Shirovasti, and Sarvangadhara. So those things important for the Shirodhara and Shirovasti, pouring, oil pouring methods, and oil. It's important oil for increase the brain functions. So it has already mentioned about authentics. So we have used that kind of oil for the head massage and head pouring methods, and body massage. Especially we use Vata pacifying in our Ayurveda. There are 3 types Vata, Pitta, Kapha. Our concepts that hyperactivity conditions and aggressive conditions we manage according to the Vata pacifying methods using Sarvangadhara, Viryaka, and Vasti. And other than that, we encourage to the parents behavior therapy, especially turn off the TV and social media, and encourage to music therapy in Ayurveda hospital. Also, we have used that, and encourage group activities, yoga and meditations, and we encourage to create a routine methods to kids. Especially, we try to follow the same schedule every day for wake up time to bedtime, and encourage put in school bags. We inform to their parents to do those things in home place, that school bags, clothing, toys in the same place every day. So they will be less likely to lose them. So they will practice the daily routine according to the instruction. And these are the extra activities we have done with the kids in hospital base. And so they like to do so those things. We use our intern medical officers doing those things in hospital base. And also yoga and meditations also help to manage that kind of conditions in Ayurveda setup. Also, we advise to do those things for the management of mental disorder. And these are the results, effect of treatments. And uh, before the treatments, that first round of treatments, most of them are in very often unchanged group, that 75 to 100% signs and symptoms associated with all the 5 kids. After the first round treatments, except one, other 4 kids improved moderately improvements we have observed. Then second round treatments. After the second round treatments, two kids, uh, especially they shown the markedly improved improvements, and also one kids they also got improvements, and other 2 stayed in same level after the second round treatments. When they complete the third round treatments, 2 kids, the complete remissions, it means that signs and symptoms reduce less than 25%. I remember that one got 21% and my other one got 17% page of signs and symptoms. But other 9 years girl baby, that she remained with improved, moderately improved signs and symptoms. It remain 50 to 75% after the third rotation also. And identify associated, most of the kids out of 5 associated etiologies are stress in prenatal pregnancy period, that the parental stress, especially mother's stress in prenatal and postnatal periods. And screen addiction is the most high etiologies associated with our kids. Not only the research group, that other kids in our hospital also, not only the ADHD, but autistic babies also more identified main associated etiologies: screen addiction and bad food addiction, and bad parental-child relationship, lack of love and care, parental insult, and less time sharing by parents. So most of the things associated with parent and child relationship. According to the Ayurveda concepts on association etiologies for mental disorders, that there are several points that most, especially Sahaja Nidan, another Sahaja, that inherited genetic points. There are a lot of points associated mentioned in our authentics associated, that pre-conceptional as a preconceptional causes, and antenatal factors and postnatal factors, especially associated with the pregnancy period, stress and other disorders associated with the pregnant mother, and postnatal factors associated with the kids. Also, we have done several studies. We study the association of prenatal, natal, and postnatal factors. It's all the points are mentioned in our the authentic text under the etiologies of mental disorders. Identified main etiology is misuse of senses. It means especially for the screen addiction. It also mentioned in authentic texts under the asatmi indriyartha sanyoga. So it's mean that it was improper contact of the sense with their objects, and resource is overstimulation of deficiency of sensory activity. These are the points we mentioned in our the authentic test under the Charaka Shustrasthana. In reference. And other than that, food patterns of the child, most of our kids usually use that junk foods. And according to the Ayurveda concepts, it's clearly mentioned before 3,000 years ago that most associated food taste for the mental disorders are spicy taste. It's mentioned in Kadu Rasa, and salty taste, lavana rasa, and bitter taste, tikta rasa. But usually kids not use the bitter, but they have usually use the choco mix, that other bitter ingredients will associate with that some foods items. So these are the things mentioned that it mentioned, and it will directly, those food taste directly associated the reduce the brain functions and mental development. It has clearly mentioned in Ayurveda Authentics. And other than that, I have identified our kids, most of them having problem with that parent-child relationship. It's clearly mentioned in our the Lalayat Panchavarsha. It's a stanza mentioned in our the Authentics that Lalayat Panchavarsani Dashvarshani Tadayet Praptetu Shodashe Varshe Putram Mitravadacha. It means Lalayat Panchavarsani means that give lots of love and indulge a child for the first 5 years. Pancha is for first 5 years. And again, that Dashavarshani Tadi, it means how to, yes, we can deal with next 10 years, deal firmly with the child. So we can advise, we can do the advices, and we can manage the child very firmly in when they after the 5 years, up to 16 years. Praptita Shodashe Varsha, it means once the child is 16, treat him as a friend. These are the main message in mentioning our either to the parents. So we have to work alone with them. So that is why we have to keep parent-child relationship, very good relationship during the first 5 years, especially. So we give lots of love and indulge to the our children. And so I would like to conclude here that study main outcome was are the treatment statement help relieve the signs and symptoms of ADHD, and hence this study had a positive outcome and can be recommended as a therapeutic procedure for the management of ADHD condition. So recommendation, as a recommendation, it should generalize the research to other patients, and further studies required with the extensive study group. It's not that's just case studies. So we have to do the study with the extensive study group, and also child can get more effects. We have identified not only this case study, we have identified that if we start the treatments, are the treatments in age of early stage of life, it will help to reduce that signs and symptoms very easily. Therefore, more effect if she or he starts the treatments in an early stage of life for her or his mental disabilities. Not only the mental disorders, we are here continuing treatments for cerebral palsy conditions. So we have identified, if we start the treatments before 2 years, it's very much, we can manage those things very easily. Their signs and symptoms managed very easily. for the early stage of the life. And these are some references. And I would like to offer my thanks to again for the Magnus Group for inviting me as a speaker. Thank you.